So, question is, what is a silent heart attack? Does such a term exist? Do patients get heart attack which is silent? Yes, they do. So, how do we understand what it means and how can a doctor inform his patient that what he has to observe? So, heart attack classically gets chest pain in the front of the chest, which can radiate to both the arms. It can radiate to the left side, but it is generally a feeling of oppression or heaviness in the chest. This is the commonest symptom of heart attack. Some people may not get this symptom. Some people may just get sweating on the hands, palms, or some may just feel as if they have heavy breathing. They are not able to breathe properly. And when the ECG is done, when the patient goes to the hospital and ECG is done, the hospital doctors detect it as a heart attack. So the question number one is that how do we detect a person having these kinds of symptoms? So every symptom which I suggested, like heavy breathing, sweating, not feeling well, without any chest pain, could be a heart attack. Second, people who are elderly and who are diabetics are the most often who get silent heart attack. They may not get any pain. They may just get some breathing difficulty, which they may ascribe to lung infection or asthma and not come to the emergency room. For a doctor to diagnose a silent heart attack, he needs two things. He needs an ECG and a blood test, which is an enzyme in the blood called troponin. So if the troponin is elevated, a physician can actually suspect a heart attack. And how do we treat a silent heart attack is as bad as a heart attack which happens with pain. So they can both lead to problems, they can both lead to death, and both have to be treated rather rapidly. So silent heart attack is a term which is given for patients who do not get chest pain and end up having a heart attack. And as a person, one has to be careful that symptoms of chest pain may not always be there with heart attack, and there may be other symptoms. And as a physician, we are always aware of this fact that a patient may not have chest pain, and we have to rely on ECG and some blood test to detect heart attack. And it is not an uncommon entity to have this problem.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.